Welcome to the deep dive. Today we're tackling atrial premature complexes, APCs for short.
Right.
Think of them as little hiccups in the heart's rhythm, extra beats, basically, starting early in the top chambers, the atria.
Exactly. Premature beats.
We've got some good info here from our source text, and our mission today is really to get our heads around what these APCs are,
Yeah, what they mean.
especially in dogs and cats, right? What causes them? Are they serious? What can we do? We want to keep it clear, not too, technical.
Absolutely. Make it understandable.
Maybe you've heard this term or you're just curious about heart stuff. So let's dive in.
Okay, let's start with the basics then. Atrial premature complexes. The key word is definitely premature.
Too early.
Right. These heartbeats jump the gun. They start somewhere in the atria, but not the usual spot.
Not the pacemaker, the SA node.
Exactly. Not the sinoatrial node. So this early beat just throws the regular rhythm off for a moment.
Okay, so if the heart's got this steady beat, dud, dud, and APC is like a little extra duh that sneaks in too soon.
That's a pretty good analogy, yeah. It disrupts the flow.
So how does that look on an ECG, an electrocardiogram?
Well, the first thing you'd probably spot is the rhythm isn't regular anymore. It's uneven.
Makes sense.
And specifically, you're looking for a premature P wave. Sometimes we call it a P prime wave, written P apostrophe.
P prime, and that looks different.
It often does, yeah. Remember, the normal P wave is the atria contracting. This premature one, P prime, might have a different shape, maybe upside down, or sometimes it's really subtle.
How so?
It can actually be buried, like hidden right at the end of the T wave from the beat just before it.
Wow, okay. So you really need to look closely.
You definitely do. Takes a trained eye sometimes.
Okay, so you spot this early, maybe weird-looking P prime wave. What comes next?
Usually what follows is a QRS complex that looks pretty normal.
And the QRS is the ventricles, the lower chambers contracting.
Correct. So the signal usually gets down there okay.
Mhm.
But, and this is important, if that P prime happens really early, like while the pathway down to the ventricles, the AV node, is still kind of resetting.
Still recovering from the last beat.
Exactly. Then the signal might just stop. It doesn't get through.
Oh.
So you see the P prime wave, but there's no QRS after it. We call that a non-conducted APC. The atria fired, but the ventricles didn't get the message in time.
Okay, non-conducted. Got it. The upper chamber signal, but the lower ones are on pause.
Pretty much.
What if the signal does get through, but maybe the pathway is still a bit sluggish, not fully ready?
Right. That can happen too. If the AV node or the pathways lower down haven't quite reset properly, the signal might take longer to get through.
Okay.
So you might see a longer gap between the P prime wave and the QRS, a longer P prime R interval, or the signal might spread through the ventricles abnormally, leading to a QRS complex that looks different, a bit wide or just misshapen. We call that aberrant conduction.
Aberrant conduction, like
Yeah.
it took a weird detour.
Sort of, yeah. And the earlier that premature beat comes, the more likely you are to see that aberrant conduction. The pathway just isn't fully prepared.
Okay, this is making sense. Early P prime wave, maybe different shape, maybe no QRS, maybe a weird QRS. Is there anything else on the ECG? Something about a pause?
Yes, good point. The non-compensatory pause.
Mm-hmm.
That's quite characteristic.
Non-compensatory, what does that mean?
It means that after the APC happens, there's a pause before the next normal beat comes along.
Okay.
And if you measure the time from the normal beat before the APC to the normal beat after it, that total time is usually shorter than the time it would take for 3 normal beats to happen.
Shorter. Why is that?
Because that early atrial beat, the P prime, actually goes back and resets the heart's main pacemaker, the SA node. It discharges it early.
Oh, okay. So it doesn't just add an extra beat, it messes with the timing of the next normal beat, too.
Exactly. It kind of forces the SA node to start its countdown again from scratch a bit sooner than planned, like a record skipping, maybe. It needs a brief moment to get back into the regular groove.
The skipping record analogy helps. Okay, so what's actually causing these APCs? What's going on electrically inside the heart? Is it just random?
Well, it's rarely completely random. The source points to 2 main mechanisms, basically 2 ways this can happen.
Okay.
One is called increased automaticity. Some atrial heart muscle cells just get, well, a bit overexcited. They start firing off electrical signals on their own before the main pacemaker, the SA node, tells them to.
So rogue cells firing early.
Kind of, yeah. They develop their own rhythm, temporarily. The other way is something called re-entry.
Re-entry, like the signal goes back.
Sort of. Imagine a little loop, an electrical circuit, forms within the atrial tissue. The electrical signal gets caught in this loop and just keeps going round and round, repeatedly stimulating the muscle.
Ah, like an echo almost that keeps triggering beats.
That's a good way to think of it. So either overexcited cells or this reentry loop pattern.
Okay. Now, something important here. Our text mentions that APCs may be a normal finding in aged dogs. That sounds reassuring.
It is, definitely. It's a really key point. Just like people can get occasional skip beats as they get older, it seems some older dogs can have APCs just as part of the aging process. Doesn't necessarily mean something terrible is wrong.
That is good to know. But there's usually a but.
There often is. While they can be normal in older dogs, we also see them very, very commonly alongside atrial enlargement.
Enlargement of the top chambers.
Yes. And that's often caused by chronic mitral valve disease, especially in older, smaller dog breeds. That's a really common heart condition.
Right, I've heard of that. So leaky valve leads to bigger atria, leads to APCs.
That's a very common pathway, yes. And really, almost any disease affecting the atria in either dogs or cats can potentially trigger APCs.
So a few random APCs in my old dog might be okay, but if they're happening a lot or if we know he has heart disease, that's different.
Exactly. The significance really depends on the context. How frequent are they? When do they occur? And crucially, what's the underlying heart health like? The APCs themselves might not cause any problems you can see, but they can be a warning sign.
A warning for what?
That more serious rhythm problems might be developing, or could develop later. Things like atrial fibrillation, or atrial flutter, or atrial tachycardia, much faster, more chaotic rhythms.
Wow. Okay. So these little hiccups could be like the first rumble before a bigger earthquake.
That's a dramatic way to put it, but yes, they can sometimes precede more serious arrhythmias. It adds a layer of importance to finding them.
Definitely. So who typically gets these? You mentioned older, smaller dogs with a valve disease link. Any other patterns?
Well, the source does specifically highlight small breed dogs as having a higher tendency.
Okay.
And generally, yes, older animals. The main exception would be animals born with heart defects, congenital heart disease. They might show APCs at a younger age.
And it affects both dogs and cats?
Yes, both species can get them.
Okay, so think older, small dogs, maybe cats, potentially younger animals with birth defects. Now, what would an owner actually see, if anything?
That's the tricky part. Often, absolutely nothing.
Really? No signs at all?
In many cases, no. The animal seems perfectly fine. The APCs are just found during a vet check, maybe listening to the heart.
Huh. But sometimes there are signs.
Yes, but usually those signs are related to the underlying problem, especially if it's progressed to something like congestive heart failure or CHF.
Ah, okay. So what would those signs be?
Things like coughing, especially a persistent cough, difficulty breathing, maybe getting tired really easily during exercise, or even fainting spells, which we call syncope.
Okay, coughing, breathing issues, low energy, fainting. Those sound more serious.
They are. They usually point towards significant heart compromise like CHF.
So the APCs might be silent, or they might be part of that bigger picture. If a vet is examining an animal, what might they find?
Well, listening with a stethoscope, the most obvious thing would be that irregular heart rhythm. The beats aren't evenly spaced.
The skipped beat or early beat?
Exactly. They might also hear a heart murmur, which can indicate valve problems, or maybe a gallop rhythm, an extra heart sound. Both can suggest underlying disease.
And signs of CHF, maybe?
Yes, potentially signs related to fluid buildup if CHF is present.
Okay. So if APCs are suspected, what kind of things are causing them? You mentioned aging, valve disease, atrial enlargement. What else?
It's quite a list, actually. Besides chronic valve disease and aging, we're looking at congenital heart defects, different types of cardiomyopathy, that's disease of the heart muscle itself.
Right.
Also, inflammation of the atrial muscle, myocarditis, electrolyte imbalances can do it, tumors near or in the heart.
Tumors, wow.
Yeah, neoplasia. Also, hyperthyroidism, especially in cats. Exposure to certain toxins, even some drugs like digitalis, if the levels aren't right.
That's a lot of possibilities, so it really underlines the need to figure out why they're happening.
Absolutely. Finding the underlying cause is key.
So how does the vet nail down the diagnosis, confirm it is APCs, and try to find that cause? What are the steps?
Well, first, they need to make sure it is APCs and not something else that sounds similar.
Like what?
Like a really pronounced sinus arrhythmia. That's a normal variation in heart rate with breathing, but sometimes it can sound quite irregular. Or they need to distinguish it from premature beats coming from the ventricles, the VPCs, especially if those look a bit unusual on the ECG.
Okay, so ruling out mimics first. Then what? Imaging.
Yes, imaging is usually crucial. An echocardiogram, an ultrasound of the heart, is really important.
What does that show?
It lets us see the heart structure, measure the chambers, see how the valves are working, how well the muscle is contracting. Doppler ultrasound helps assess blood flow through the heart. This is vital for finding underlying structural disease like valve issues or cardiomyopathy.
Makes sense. See the mechanics. But for the electrical part, the ATCs themselves.
For actually seeing the APCs and confirming what they are, the ECG is the gold standard.
The electrocardiogram again. That shows the P prime waves, the pauses.
Exactly. It captures the electrical signature of the APC. But a standard ECG is just a snapshot, right? Maybe a few minutes long.
Yeah, what if the APCs aren't happening right then?
Precisely. That's a common issue. If they're intermittent, a short ECG might miss them entirely.
So you need longer monitoring.
Yes. That's where a Holter monitor comes in.
The portable ECG.
Right. It's worn by the animal, usually for 24 hours, continuously recording the heart rhythm.
Ah, so you get the whole day's picture.
Exactly. You can see how frequent the APCs are, if they happen more at rest or during activity, if they're happening in clusters. It gives much more information. And you can try to link them to any symptoms the owner might notice.
What about event monitors? Are they different?
Similar idea, but
Yeah.
they can sometimes record for longer periods, and often they have a trigger, so the owner can press a button if they see the animal having an episode to make sure that specific event is captured.
Gotcha. Holter for continuous, event monitor maybe for longer term symptom-triggered recording.
Yeah.
Very useful tools.
Definitely vital for understanding the frequency and significance.
Okay, so let's say APCs are diagnosed, and the vet decides they are significant, maybe they're frequent, or there's clear underlying disease. What's the treatment approach?
The number one rule is treat the underlying cause, if you can identify one.
Right. Always go for the root problem.
So if it's congestive heart failure causing atrial stretch and APCs, you focus on managing the CHF. That means medications like diuretics to remove fluid, maybe ACE inhibitors, pimobendan to help the heart pump.
And does treating the CHF help the APCs too?
Often, yes. The source text notes that getting the CHF under control can actually reduce how often the APCs happen. Same idea if it's a hyperthyroidism or an electrolyte problem, fix that, and the arrhythmia might resolve.
That's great. Treat the disease, fix the symptom. But what if that's not enough? Or if the APCs themselves are causing problems or seem risky?
Then you might consider medications specifically aimed at suppressing the APCs, antiarrhythmic drugs.
Okay. What are the options there, say, for dogs?
For dogs, the main ones mentioned are digoxin, diltiazem, and atenolol.
Digoxin. Isn't that also used for heart failure?
It is, yes. It has effects both on heart strength and rhythm. The text highlights it as a primary choice, especially if heart failure is present along with the APCs. Diltiazem and atenolol are other options, often beta blockers or calcium channel blockers.
And the vet figures out the dose.
Absolutely. Dosing is critical and needs careful calculation and adjustment for each individual animal.
What about cats? Same drugs.
It could depend on why the cat has APCs. If it's due to hypertrophic cardiomyopathy, HCM, which is common in cats.
Right, the thickened heart muscle.
Yes. Then diltiazem or atenolol are often preferred. If it's dilated cardiomyopathy, DCM, which is less common now, but still seen, digoxin might be considered. Again, dosages are specific.
So the drug choice really depends on the species and the specific heart disease. Are there drugs you should avoid?
Yes, definitely. The text warns against using certain drugs called negative inotropes like propranolol if the animal already has CHF.
Why is that?
Because negative inotrope means it weakens the heart's contraction, which is the last thing you want in heart failure.
Makes sense. Don't weaken an already struggling pump. Any other precautions?
You need to be cautious using any of these antiarrhythmics, digoxin, diltiazem, atenolol. If the animal had other underlying electrical issues like AV block, where the signal is already slow getting through the heart, or if they have low blood pressure, these drugs could potentially make those worse.
So it's a real balancing act. Careful assessment is key.
Very much so. You have to weigh the risks and benefits.
What about things the owner can do? Nursing care? Activity? Diet?
Generally, specific nursing care for the APCs isn't needed unless it's tied to the underlying condition like managing CHF symptoms.
Okay.
Activity might need restriction, though. If the animal is showing signs like fainting or getting easily exhausted, then yes, limiting strenuous activity is important.
And diet. Special food.
Usually no specific diet just for the APCs. But again, if there's an underlying condition like CHF, then a low-sodium diet might be crucial for managing that.
So mostly about managing the bigger picture. What about owner education?
That's huge. Owners need to understand what APCs are, that they might be benign or might be serious, and why monitoring is important. They need to know what signs to watch for worsening cough, breathing trouble, fainting, and report them right away.
Be vigilant partners in care.
Exactly.
So after diagnosis and starting treatment, what's the follow-up like? What's the long-term outlook?
Well, regular follow-up is crucial. This often involves repeat ECGs to monitor the heart rhythm, see if the APC frequency is changing, and check if the medications are working or need adjustment.
And what's the expected course? Do APCs usually get better, worse, stay the same?
The prognosis really depends heavily on the underlying cause and how severe it is. One potential complication is that very frequent APCs can actually make heart function worse over time, especially in a heart that's already diseased.
So they can contribute to the problem.
They potentially can, yes. And the source notes that even with treatment, as the underlying heart disease progresses, the APCs might become more frequent, or more serious arrhythmias like atrial fibrillation could still develop later on.
So it's often a progressive situation that needs ongoing management.
Unfortunately, yes, especially when linked to chronic heart disease.
Okay, let's try to wrap this up then. To summarize, atrial premature complexes, these APCs, are extra early heartbeats from the atria.
Right, the upper chambers.
They can be, surprisingly, just a normal thing in older dogs sometimes. But often, they're linked to underlying heart problems, valve disease, muscle disease, atrial enlargement in both dogs and cats, especially those small breeds getting on in years.
It's a good summary.
They might be totally silent, or they might show up alongside signs of heart failure, like coughing or breathing issues. Diagnosis hinges on the ECG.
And maybe a Holter monitor for the bigger picture.
Right. And treatment really focuses first on tackling that underlying cause. If the APCs themselves need suppressing, meds like digoxin, diltiazem, or etomol might be used, but carefully chosen based on the animal and their condition.
And ongoing monitoring is key.
Absolutely. So these little skips or hiccups can sometimes be more than just that they can be whispers of a bigger cardiac story brewing. Really highlights why those regular vet checkups are so important when you say, especially for our older pets.
Couldn't agree more. Early detection makes a difference.
Definitely food for thought. Which brings me to a final question for you, our listener, to ponder. Considering how these tiny electrical hiccups in the heart can sometimes be silent yet potentially significant, what other subtle signals might our bodies or our pets' bodies be sending us that maybe we should pay closer attention to? Something to think about. Thanks for joining us on this deep dive.